Hey there! I'm about to dive into a fascinating and important topic that's been making waves in the UK. It's a story of a rare genetic condition, SMA, and the impact of celebrity advocacy on healthcare policy. But before we get into the details, let's set the scene. Imagine being a parent, welcoming a healthy baby into the world, only to discover months later that they have a rare condition. This is the reality for families like Warren Davies and his daughter Ophelia-May, who has SMA type 2. Now, here's the twist. While routine screening for SMA is being implemented in England and Scotland, Wales seems to be lagging behind. Why is that? Is celebrity influence the only way to drive healthcare policy changes? First, let's talk about SMA. This condition causes muscle weakness and can have a huge impact on a child's development. The key here is early diagnosis and treatment. If caught early, medication can significantly improve outcomes. But here's the kicker. Wales isn't offering routine screening, despite the clear benefits. This is where the story gets personal. Warren and his partner noticed physical delays in Ophelia-May around 6 months old. But the message they kept hearing was, "She'll catch up." It wasn't until much later that she was diagnosed, and by then some muscle function was already lost. This is a heart-wrenching situation, and it raises questions about the role of healthcare systems in early diagnosis. Now, enter Jesy Nelson, a celebrity with a powerful platform. Her campaign for SMA screening has been a victory in England, but what about Wales? The Welsh government claims to follow UK guidance, but parents like Warren feel let down. They believe the government is playing God by not implementing routine screening. This is a bold statement, and it highlights the frustration and powerlessness these families feel. Personally, I find it intriguing how celebrity advocacy can fast-track policy changes. It's a double-edged sword. On one hand, it's great that Jesy Nelson's campaign has raised awareness and driven action. But on the other hand, should healthcare decisions be influenced by celebrity status? What about the hundreds of other conditions that don't have a famous advocate? This is a deeper question we should all be asking. The impact of this situation is profound. Charlie Brown, another parent affected by SMA, feels both happy for England and Scotland, but sad and jealous for Wales. He believes Wales shouldn't be left behind, and I couldn't agree more. The evidence is there, and the benefits are clear. It's absurd that a first-world country like Wales isn't taking action, especially when the treatment is available and effective. What's even more striking is the personal stories of these families. Warren and his partner are fundraising for private therapy sessions for Ophelia-May, as the NHS can only offer limited support. This is a testament to their dedication, but it also highlights the gaps in the system. The Welsh government urges parents to seek help, but are they doing enough to provide it? In my opinion, this situation is a wake-up call for healthcare systems everywhere. Early diagnosis and treatment should be a priority, regardless of celebrity involvement. The power of advocacy is undeniable, but it shouldn't be the primary driver of policy changes. We need to ask ourselves, how can we ensure that all conditions, not just those with famous advocates, get the attention they deserve? So, what's the takeaway here? It's a call to action for governments and healthcare providers to listen to families, to prioritize early diagnosis, and to ensure equal access to treatment. It's also a reminder that celebrity influence can be a powerful force for change, but it shouldn't be the only catalyst. Let's use this story as inspiration to advocate for better healthcare policies, because every child like Ophelia-May deserves the best possible chance at a healthy life.